Hello, hello. Anyone who is joined in, can you please comment एक बार? नहीं तो मुझे पता नहीं चलेगा कि लोग ज्वाइन हुए हैं. We'll wait for maybe a couple of minutes. 2-3 मिनट वेट करते हैं and then we can start the live stream. जिसने भी ज्वाइन किया प्लीज कमेंट कर देना एक बार. काफी कम लोग हैं अभी के लिए, बट एटलीस्ट जो लोग आए हैं मुझे पता चले कम से कम कौन कौन आया हुआ है, सो दैट वी कैन हैव एन एनरिचिंग डिस्कशन. इफ नॉट तो मैं थोड़ा डिमोटिवेट हो जाऊँ करते हुए. तो जो लोग भी ज्वाइन किए हैं प्लीज मेंशन इट इन द कमेंट्स. विल वेट फॉर अ कपल ऑफ मिनट्स, मे बी 2-3 मिनट और वेट करेंगे एंड देन लेट्स सी हाउ मेनी पीपल ज्वाइन एंड देन वी कैन स्टार्ट फ्रॉम देयर. But please, anyone who has joined in, please do mention it in the comment section. Hi Ravesh, क्या हालचाल? Please, anyone else also who has joined in, do comment, please. मैच दिख रहे हैं लोग सब. आई नो मैच काफी इंटरेस्टिंग मोड पे. कहाँ पहुंचा है मैच अभी? आई थिंक 2 आउट हुए थे. हाउ मेनी पीपल आर वाचिंग द मैच साइमल्टेनियसली or at least following it on like crick buzz or something कि score क्या हुआ, etc etc. Cool. Let's give it 1 or 2 more minutes and then we can get started. We'll just wait for 1 or 2 minutes for people to join in and then we can get started. But please mention it in the comment section. Yeah, people who have joined, please. Hi, Shamshu. 33 for 2. Nice. Nice, nice, nice. So, rooting for India. I think we can still make it. It should not be that far of a journey. Shamshu, watching the match on live stream together or following it in between, like on ClickBuzz, etc. Cool. I think let's dive in. I think we have already crossed a few minutes. ClickBuzz, nice, nice, nice. So we'll get started. And wherever I think yesterday I got some feedback from people, and then based on that feedback, I've tried to sort of mold the conversation. Nice, nice, Shamshu. So let's try to see what all we know about the situation, and then we will build up from there. The intent is not only to focus on Matthew Perry's life and how he died, but the intent is also to understand a big part of his life, which was around addiction and trying to recover from that addiction. So, firstly, how did he get into that addiction, and then how did he recover out of it? Nobody really knows right now. People are saying he like died because of drowning, etc., in a hot tub, but it's slightly hard to believe. So no one really knows that for sure. But everyone knows his story to some extent of addiction and overcoming that addiction. And maybe some people would also know how he got into it, but some people might only know it at a very high level. So let's try to dive in and understand what was his journey, and then dive in on his addiction and advocacy of addiction removal as well. So let me share my screen and then try to get into uh, just a sec. I will present my screen and then let's see how we can dive into it. Cool. Just let me know if my screen is visible. It feels like a corporate presentation, but बोर नहीं हो गए. Corporate presentation नहीं है, कुछ 5-7 slides डाली हैं. तो people tell me once it's visible, please give the thumbs up or uh, just mention it that it's visible. Nice, nice, nice. Cool. So I think everyone knows here the person, and people who have joined in might be already well aware of him. So not to say a lot, I think most famous part of his journey, Perry's journey, is the Friends sitcom, which a lot of people are a fan of. PRD नहीं है. Hopefully we'll move into that direction, but it's not a PRD for now. But a few slides which I've just try to get together. Cool. So a few points about him: American Canadian actor, comedian, as well as producer, primarily known for his sitcom Friends. But he also sort of starred in films like Fool's Rush, Russian, Almost Heroes, and Whole Nine Yards. At the same time, he also starred in television series like Studio 60, On the Sunset Strip, and The Odd Couple as well. And this part of the journey is where I want to focus on more, which is the addiction awareness and prevention, which might also be one of the reasons of his, let's say, loneliness or being in a hot tub, etc., because of which he died on yesterday at the age of 54. So let's focus on that part because I feel if we try to cover everything about that journey, it might be a little difficult to cover everything, but at the same time, we might be able to learn a lot from his life and his struggles around drug addiction and advocacy. Cool. So let's see how he got into this in the first place. So basically, what happened is that I think he got into a jet ski accident in 1997, wherein I think the doctors prescribed him Vicodin for pain relief. But this particular medicine also has addiction properties, and because of that, he quickly got addicted to it. And then what happened is over the next few years, Perry's addiction escalated and he began abusing other substances as well, like methadone, amphetamines, and then he also started to drink heavily. And what happened is that that started to have a lot of significant impact on his life and career. So he was late to work, he sometimes missed filming entirely, and also became erratic and unpredictable at times. So this also was during the period when he was also filming Friends during, I think, season 3 to season 6. And it was like in 2001, he reached a low point wherein he got hospitalized with pancreatitis because of this alcohol abuse. And because of that, he also lost a significant amount of weight and his appearance changed drastically around that time. So, this is his drug addiction phase. Then, second is his recovery phase, which is like after his hospitalization, he finally decided to seek help. इट्स ऐसा बोलते हैं ना कि जब तक इंसान को थोड़ा झटका ना लगे तब तक वो एक्चुअली चेंजेस करने की सोचता नहीं है. So I think same thing happened with him wherein he decided to seek help only after he got hospitalized. So he entered into rehab, got sober, and he says that he said that it was the best decision that he ever made. And he credits it to a lot of faith and his support system. And he also helped a lot of people who were struggling with addiction. So this was more around his recovery briefly. And then finally, because of his recovery, he also became an advocate, wherein he advocated for addiction awareness and prevention. He spoke about his own addiction journey and the importance of seeking help. And then finally, he also sort of did a couple of things with the government, which is essentially he was associated with the National Association of Drug Court Professionals. I think this drug court is essentially a code wherein you're not convicting a person who is doing drugs, but you're actually helping him. But during that time, you have to come to the court regularly and see if you are improving or not. And then, basis your improvement, the judge suggests whether you have to be penalized or you can actually lead a normal life. We can get into this much more in the later stages, but this was something interesting that I got to know. Okay, there are concepts of drug courts. And finally, one good thing he also did is that he built a sober living facility in his own mansion in Malibu, California. So this entire his old mansion was converted to a sober living facility, which was his advocacy. I think I'll keep it brief here, and I would want to firstly other people anything in particular. I want the conversation to be focused more on drug addiction and OKC, but anything in particular about Matthew Perry's life or his drug addiction or in general thoughts of what we have discussed till now. Cool. So I think if we are not wanting to discuss on Matthew Perry's life, I feel the interesting segue to this would be to understand addiction in a much more deep sense. I think one comment is there with Bhavesh that he has heard about it and how, oh, nice. Yeah. So I think this was something that I got to know today itself, that he actually converted his mansion to a drug rehab facility for people. Cool. Let's dive in into addiction then. If we have covered the Matthew Perry life or anything people feel that we don't need to discuss further as well. Cool. So let's see what are the different types of addiction. Firstly, like if I try to see, I feel when we say addiction, we primarily think about drug addiction in general, like people are mostly often addicted to drugs. But there are various kinds of addictions that sort of occur right now in the world, right? There is substance addiction, which we talked about, which is, let's say, alcohol or drug. But at the same time, there are behavioral addictions as well. Why do people get into addiction? I think, yeah, we will cover that. I think firstly, let's cover what kind of addictions exist, and then we'll try to cover what what causes people to get into these addictions. So, but interesting point. So I'll keep a note of that, Aniket. So behavioral process addictions are there. So things like gambling addiction, internet and technology addiction. Everyone is right now, हर कोई social media खोल के बैठा हुआ है कि uh, दिन के 5-6 घंटे तो उसी में चले जाते हैं मैक्सिमम लोगों के. Sex addiction. There is shopping addiction. There is food addiction. So, and I think this also, whenever someone faces like mental trauma, stress हो जाता है, तो काफी लोग mental like food binging पे भी चले जाते हैं कि यार खाते रहते हैं, कोई परवाह नहीं कि क्या exercise करनी है नहीं करनी है. And there are people who do the complete opposite. There is exercise addiction as well, wherein people physically exert themselves so much that it causes them physical harm. I have personal instances of people who actually uh, मतलब उनको पीठ में there was complete like pain, but still because they were not in a good mental state, they kept on running and all of that, and that sort of hampered their overall life. There's nicotine addiction, there is work and career addiction as well, wherein there's an obsessive devotion to work, right? कि मेरे को काम ही मेरी पूरी जिंदगी है, and many times people regret it much later कि यार मैं पूरी जिंदगी काम ही करते रहा और मैंने अपनी लाइफ में पर्सनल रिलेशनशिप्स को कहीं पे इंपॉर्टेंस नहीं दी. uh, Prescription medication addiction. I think opioid addiction is a big thing in the US, and there were a lot of people who got addicted to opioids like oxycodone and hydrocodone. I think alcohol and drug we have discussed, social media we have discussed. There's video game addiction, especially when we're kids, right? Kids, everyone like was completely into these Mario of the world or Contras of the world to begin with, and then we moved to like Age of Empires, Dota, Counter Strike, and all of that, right? And then there are things like codependency, like even there are cases wherein you get attached to an individual, जिसमें there is an influencer and you feel one-sided love for the influencer and you get addicted to their personality that you're willing to do anything. There are cases in the south जिसमें I think जयललिता के लिए people had actually self-immolated themselves, like they burned themselves just because Jayalalitha was had to step down or something like that. And finally we have mental health addiction. I think this covers a lot. Anything in particular, people you feel we have missed out, which is sort of a big kind of addiction that people feel these days, or we have covered mostly in everything, and then let's try to get into why people get addicted in the first place. Anything in particular, guys, should we discuss around why people get different types of addiction that we have not covered? Or should we move more into why people get addicted in the first place? I think in this case, Matthew Perry cause started when he got into a jet ski accident. So many a times it's not like personal trigger. हम लोगों को जरूरत से ज़्यादा we sort of blame them that a person would have gotten into an addiction themselves. But many a times it happens that they don't get into an addiction. It is actually some kind of an accident. With Matthew Perry के केस में हुआ है, right? कि जेट स्की का एक्सीडेंट हुआ एंड डॉक्टर ने पेन किलर सजेस्ट करा बट वो पेन किलर एडिक्टिव था. So people moved into that. Cool. I think a few comments are there. So Shamshuddin says, didn't know that there's so yeah, bro. I also came to know right today. So I think some of these addictions are, I think everyone is sort of facing these social media and all of these, but a few of them I also sort of learned in the first time today. Is OCD also an addiction? This is, I think, interesting. Let's see. Let's see what ChatGPT has to say here. Is OCD also a form of addiction? देखते हैं. OCD is not considered a form of addiction. क्यों? While OCD and addiction share some similarities in terms of their compulsive behaviors, they are distinct mental health conditions with different underlying mechanisms. Okay, so I think I think all of us have some kind of OCD at some level. कुछ ना कुछ हर किसी को ओसीडी रहता है किसी ना किसी चीज का. सो आई थिंक एडिक्शन इसको नहीं कंसिडर किया जा सकता बट it is a condition. I think right. I think Dr. Kapil is right on that front that it's more like a condition. Okay, any habit which has trigger and is difficult to shut off is an addiction. So okay, so social media also has a trigger, and I think all the other kind of addictions that we have seen here have some kind of a trigger. I think in sex addiction, there's the dopamine trigger. In case of shopping addiction, also the dopamine trigger, I think, is what causes it. In case of career may it'll be interesting to know like what kind of trigger exists during a career addiction or maybe a workaholic person. That would be interesting, like to understand. I feel like what kind of triggers exist uh, when someone becomes a workaholic. Okay, this is okay. So people have these kind of triggers. Like there's perfectionism. People want to be perfectionists. There's fear of failure that they might be. It sort of attacks their self worth. There's high expectations and general competitive environment, job insecurity. I think, and all of that lead to a lack of work life balance, stress, and anxiety. Nice, nice, nice. Cool. So I think we have covered addictions to a large extent, and I think OCD part has been covered here, wherein it is not a form of addiction, but it is sort of a condition that people have. Cool. Any habit which okay. So and then I think Anshika says, do you think people are wired to one sec specific behaviors or triggers, be it any type of addiction? People are wired to specific behaviors or be it any type of addiction. I think yes. Like, what do others feel like? Because I feel there are certain specific hormones in every individual at a biological level. There is testosterone, there is dopamine, there is oxytocin. I think there are certain hormones that are present biologically across all humans, right? And everything that is mentioned here, right? Be it alcohol, drug, gambling, has some kind of an association with some hormone, right? अब मैक्सिमम चीजों से तो डोपामिन ही रिलीज होता है बट कुछ चीजों से हमारे को सेंस ऑफ सेल्फ वर्थ बढ़ती है या ऑक्सीटोसिन से people actually feel more bonded with the other individual. So I feel it will definitely it definitely there are some behaviors or triggers for every type of addiction, and more often than not they are related to the hormonal changes that people have. Cool. Anything else, guys, we should discuss, or should we move on to maybe causes of addiction? I think let's see what are various causes of addiction that people have. Okay, nice. So it is a complex condition with multiple potential causes. Okay, often involving a combination of genetic, environmental, physiological, and social factors. So let's, I think, cover one by one. So there are genetic factors around addiction. So first is that if someone has a family history of addiction, it can increase an individual's susceptibility to addiction. Okay. And there might be certain genes that may influence an individual's vulnerability to addiction. So sometimes it might not be in the hand of a person at all कि maybe किसी को पता ही नहीं कि मैं addicted क्यों हूँ, बट उसके जेनेटिक इन्फ्लुएंसेस में मम्मी पापा दूसरे अपने पेरेंट्स को ब्लेम करना हो गया ये, लेकिन इट्स नॉट ब्लेम पर से. एंड इफ देयर आर सर्टेन जीन्स दैट influence an individual's vulnerability to addiction, then we have to accept that, right? So one is genetic factors. Second is the brain's chemistry itself. Okay, so addiction often involves the brain's reward pathways, where substances or behaviors trigger the release of feel good neurotransmitters like dopamine. Repeated exposure can lead to changes in brain chemistry, reinforcing addictive behaviors. I think a best example of this is Instagram addiction, right? कि हमने पहले स्टार्ट किया था एंड उस समय एक बार दो बार वी यूज्ड टू ओपन इंस्टाग्राम. Slowly and steadily, what used to happen is that we felt good every time we opened Instagram, and that became a habit. And many a times now what happens is, I've seen it with me or many individuals, कि यार फोन खुलता ही है, हमें काम कुछ करना होता है और हम पहुंच जाते हैं कि इंस्टाग्राम कहाँ पे, और उसको खोल के रील्स देखना चालू कर देते हैं. So I think that is what is mentioned here, कि repeated exposure can actually lead to changes in brain chemistry, reinforcing addictive behaviors, like maybe opening Instagram and checking it out again and again. So first is genetic factors, second is brain chemistry, third is environmental factors. Okay, so exposure to substances, like I think in case of Matthew Perry, what happened is that he got exposed to a painkiller, and because of that he started developing an addiction. Second is trauma or stress. If someone has gone through psychological trauma, physical trauma, or chronic stress, they might also seek relief or escape through substances or behaviors. Third is जो मैक्सिमम लोगों को होता है, peer influence. भाई पी ले. अरे अब नहीं पिएगा तो कब पिएगा? पीने से मतलब कुछ आपको अलग ही एहसास होगा. अरे क्यों नहीं पिएगा? मेरे से कितने साल ज्यादा जिंदा रह लेगा, right? So peer influence has a lot to also play in terms of environmental factors around addiction. And then availability and accessibility, right? अगर availability ही नहीं है addictive substances की, तो addiction कैसे होगा in the first place, right? I think this example, like in Kashmir, when I used to sort of be there in college, पूरे कश्मीर में I think there are only 2 alcohol shops. So people don't have accessibility of alcohol. On the other side, and if you see, the number of people who would be consuming alcohol in Kashmir will be far lower than maybe someone like people in general in Bangalore, right? Because Bangalore mein it is highly accessible, the entire alcohol scene or other like abusive substances as well. Next in line is I think the psychological factors, which is mental health disorders. If someone has conditions like depression, anxiety, it increases the risk of addiction. And because people might want to use substances to self medicate, like many a times in mental health people suggest कि यार एक जॉइंट मार ले, मतलब marijuana से addiction, मतलब वो हेल्थ थोड़ा सा mental relief मिलेगा. And people might do it while they're not doing good mental health wise, but then slowly and steadily they get accustomed to actually do it every time because they feel good after doing it, right? Next is I think personality traits. Okay, so there are impulsivity, sensation seeking, low self control people, right? There are people who have this kind of personality where they are more impulsive, so they might get more affected by addiction compared to others. And some people might use it as a coping mechanism as well. I think let's cover 5, 6, 7 in some time. Abhi tak, anything in particular people you want to discuss, or which you feel that is not being covered here, or you feel that it's incorrectly mentioned here, we can dive into that. Or maybe कुछ personal इंस्टेंसेस हैं दैट पीपल माइट वांट टू शेयर कि मेरे साथ ऐसा हुआ था, या मैंने किसी कजिन को देखा है, या मैंने एक अंकल को देखा है उनके साथ ऐसा होते हुए. Randomly taking antihistaminic medicines. Okay. So, yeah, antihistaminic medicines in what cases, like Bhavesh, you have seen a few people like randomly taking antihistaminic medicines without a doctor suggesting them? Okay, cough syrups. I think in some cough syrups also, Bhavesh is mentioning that in some cough syrups also, there might be antihistaminic medicines which might lead to drug addiction or cough syrup addiction in the future, right? Because many a times in India, people use all kind of substances, like people थिनर पी लेते हैं, अल्कोहल सूंघ लेते हैं, सॉरी, थिनर सूंघ लेते हैं, व्हाइटनर का, मतलब क्या क्या नहीं करते, लाइक पीपल डू ऑल रैंडम स्टफ इन इंडिया, राइट? सो cool. I think if we don't have other things to discuss, we can go get into the social and cultural factors, right? So many cultures there is social acceptance around it, right? Like certain substances of behavior are considered completely normal, right? Just marijuana, California, may it is legal, right? So anyone who is doing marijuana in California will not feel कि यार I'm doing something addictive, right? They will feel it's normal. Everyone is doing it. I'm not getting into whether it should be done or not. But if there is social acceptance around certain kind of drugs, or maybe nicotine is the best example, right? Uh, Everyone in the country or across the world has normalized cigarette पीना. Cigarette तो इतना खराब कर रहा है बॉडी को, but everyone has normalized it. तो अब people feel कि it's okay यार, एक सुट्टा मार के आ गए लोग, but actually it's harming the body, right? But there is social acceptance over it, so people feel yeah, it's ठीक है, it's okay. Or maybe in even alcohol, right? Then there are cultural norms, like cultural attitudes or norms around substance abuse or substance use or addictive behaviors can influence. Cultural norms can also influence. Like Kerala, mein, I have heard that Kerala, mein people drink more, and they even drink with their parents many a times. So if that becomes a norm, then people might not feel that it is a something that they should avoid. And then finally, I think there is early exposure and learning. People tend to experiment with substances, and sometimes people seek pleasure or relief from these addictive substances. And many a times there is lack of education and awareness in general. So I think these are the few reasons which, like ChatGPT is mentioning, for having, like, causing addiction in the first place. Anything in particular, people, you feel that has been missed out, or should be, we should discuss more about it, or maybe it's wrongly mentioned here, or any kind of personal instances, kuch bhi lagta hai, please mention it in the comments. Anshika is okay. So I think that we have covered. Antihistamine are for anxiety related problems. Okay. Oh, sorry. I thought that they are for cough syrups, but thank you, Bhavish. So basically, you're mentioning that antihistamine people take for party drugs. Okay, not as cough syrups. Got it. Got it. Got it. Cool, guys. So, anything else that you feel has been missed out in case of what can cause addiction in the first place? And if not, then we can get into the signs and symptoms. How do you know a person has actually, like, because many times people like कि भाई मैं तो कभी कभी पीता हूँ, मतलब हर दिन तो नहीं पीता मैं, right? तो कभी कभी पीना एडिक्शन है कि नहीं है, और कभी कभी मतलब कितना कभी कभी, और कितनी बार, राइट? मे बी अगर तुम 50 बार महीने में पी रहे हो और वो भी बोलते हो कि यार दिन में 2 ही बार होता है, तो पीपल माइट बी लाइक कि ठीक है यार, दिन में 2 ही बार तो एडिक्टेड हो भाई तुम, बट अदर पीपल माइट फील कि यार, द अदर पर्सन फील नहीं यार, दिन में 7 बार भी पीते हैं लोग, एडिक्शन तो वो होता है, राइट? सो व्हाट इज एडिक्शन इन द फर्स्ट प्लेस, लाइक? By the way, before we get into it, like, what do you guys think? Like, how often is often? Let's take an example of alcohol, right? How, like, when would you feel that a person is addicted? Like, maybe one time a day, one time per week, multiple times per day. What do you guys think? Like, what would you consider as an addiction in case of alcohol, maybe? Let's please mention it in the comments. Let's see what people feel like. कब एडिक्शन कब बोलोगे आप, मतलब अल्कोहल के केस में, कि एक बार पी रहा है इंसान, 2 बार पी रहा है हफ्ते में, हर दिन पी रहा है? व्हेन वुड यू कंसिडर इट एज एन एडिक्शन? देयर आर 6 people, आई थिंक, एटलीस्ट. सो एक दो कमेंट्स. हार्ड ड्रिंक्स आर द न्यू सॉफ्ट ड्रिंक्स. राइट, राइट. आई थिंक यस. सो पीपल, मतलब अभी तो हर दिन भी बियर पी लेते हैं लोग. खासकर एक्सेसिबिलिटी, जैसे गुड़गांव जैसे एरिया में जहाँ पे दारू ही इतनी चीप है, there is cheap alcohol, so people will be like, and I think in European nations also many a times soft drinks are almost as expensive as hard drinks. So many a times people will prefer even having hard drinks, right? Why would they not want to have hard drinks if it is at the same level, right? Because they feel yeah, it's stimulating my mind. Cool. Let's get into signs and symptoms of addiction then. If we don't have others things to discuss around addiction. Okay. Cool. So how do you know you are addicted or someone in your family is addicted, right? So first is craving. Like there would be an intense and persistent desire for the substance or behavior, leading to preoccupation with obtaining or engaging in it. जब भी क्रेविंग्स वाली फीलिंग आती है कि मुझे ये नहीं मिला, मतलब समथिंग इज मिसिंग इन माय लाइफ, so essentially that means that you're addicted to it. Maybe like let's take an example of a book. Maybe if you are reading a book and when you're not reading it, are you constantly thinking about going back to the book? Book might be a good example of an addiction if you're reading the right stuff, but many a times if it is Instagram that you're thinking about, or maybe alcohol, right, then it might not be the right kind of craving in the first place. Second is loss of control, right? Inability to limit or stop the use of the substance or engagement in behavior even when trying to do so. So if you, let's say if you are reading a book and you can stop it at any time that you want, you have control over it, right? And this is what I also like, right? कि मेरे पास कंट्रोल होना चाहिए कि मैं कब क्या करना चाहता हूँ. अगर आपके पास कंट्रोल ही नहीं है, right, you are giving that control to that drug or substance, right, or alcohol, right, कि अरे यार पीने का मन कर रहा है और मेरे को नहीं पीना है, और लेकिन मेरे को ऐसा लग रहा है कि मेरे को पीना चाहिए, right? So you're losing that control, you're giving it to the alcohol or that drug, right? So then if that happens, it might mean that you're addicted to it. Increased tolerance, right? Needing more of the substance or engaging in the behavior more frequently to achieve the desired effect. कि पहले एक 30 ml में हो जाता था, अब 60 ml चाहिए, 90 ml चाहिए, अब पूरी की पूरी बोतल पी रहे हैं, राइट? तो टॉलरेंस आपका इंक्रीज होते जा रहा है. दैट माइट मीन दैट यू आर एडिक्टेड टू एनी काइंड ऑफ सब्सटेंस, बीट इंस्टाग्राम ऑल्सो, राइट? कि पहले दिन में एक बार खोलते थे, अब 2 बार, फिर 10 बार खोल रहे हैं, तब भी मजा नहीं आ रहा, राइट? तो आपका टॉलरेंस इंक्रीज होते जा रहा है. Fourth is withdrawal symptoms, right? People might experience physical or psychological symptoms when attempting to cut down or quit the substance, right? कि यार बंद कर दिया तो एंजाइटी हो रही है, डिप्रेशन हो रहा है, स्वेटिंग हो रहा है कि यार मेरे को क्या हो रहा है, मतलब फोमो बोलते हैं ना उसको. जैसे फोमो तो चलो लाइट वर्ड हो गया, बट मैं इंस्टाग्राम नहीं खोला तो क्या हो रहा होगा इंस्टाग्राम में, यार मुझे नहीं पता, राइट? तो आई हैव टू गेट इनटू दैट. सो पीपल will start facing withdrawal symptoms. Then they you're neglecting responsibilities कि यार मैं इंस्टाग्राम की रील कर रहा हूँ, मैं देख रहा हूँ, मैं ड्रग्स कर रहा हूँ या फिर दारू पी रहा हूँ, ठीक है चलो वो अपनी जगह है, बट उसके चक्कर में मेरी रिस्पॉन्सिबिलिटीज ही नेग्लेक्ट हो रही है कि मैं घर का काम नहीं कर पा रहा हूँ, ऑफिस का काम अच्छे से नहीं कर पा रहा हूँ, क्योंकि मेरे दिमाग में हमेशा ये चल रहा है कि हाउ वुड आई गेट द नेक्स्ट हिट, राइट? हाउ वुड आई ड्रिंक, like let's end the work and let's go to party or drink alcohol or like marijuana, etc. There's loss of interest, like any activity that used to be interesting previously, now you're not finding it that interesting, right? Now you have more or less lost interest. Time spent, you're spending a significant amount of time obtaining, using or recovering from the substance, right? तुम्हें लग रहा है कि मुझे छोड़ना है, और वो टाइम भी तुम्हारा बहुत स्पेंड हो रहा है कि यार मैं कैसे छोड़ूं, राइट? Eighth is continued use despite consequences. You know that is going to harm. Like people drink, people सुट्टा जो मारते हैं उनको पता होता है कि यार मेरी बॉडी की लग रही है, मेरे लंग्स की लग रही है, बट तब भी यूज किए जा रहे हैं, तो वो एडिक्शन नहीं हुआ तो क्या हुआ, राइट? सोशल एंड रिलेशनशिप प्रॉब्लम्स, राइट? रिलेशनशिप में कॉन्फ्लिक्ट्स हो रहे हैं, फैमिली मना कर रही है, विड्रॉल हो रहे हैं, बट स्टिल यू आर डूइंग इट. You are doing it just for the heck of enjoying, right? You if this is not addiction, what it is, right? कि relationship में आपके conflicts आ रहे हैं, but आप तब भी you are saying, yeah, it's fine, I am okay to live with this because I'm getting that high from alcohol, I'm getting that high from smoking and everything. 10th, it's isolation, right? People can become more secretive or start to isolate themselves, because many times in Punjab I've heard कि यार people एक isolated जगह में जाते हैं और फिर वहां पे जाके drugs मार रहे हैं, right? Because they know कि अगर वो सबके सामने करेंगे, people might tell them not to do it, so you start isolating yourself more. You have more mood swings, and because these drugs are expensive, definitely financial problems भी होगा. And then at extreme levels, you can get into legal issues. There will be physical and health changes. And then there will be denial that मैं नहीं हूँ एडिक्ट, मैं ये सब तो नॉर्मल है, ऐसे सब लोग करते हैं, और तुम बहुत सारे फेल्ड अटेम्प्ट्स करोगे क्विट करने के, बट कर नहीं पाओगे. If you're experiencing any of this, there is a good likelihood that you have become an addict. Anything in particular, guys? Any like thing to discuss that has not been discussed? Any personal stories? Happy to see. अच्छा, कुछ कमेंट्स आए हैं. Okay, agree with Bhavesh. Yeah, I think Aniket, nice. Uh, True. A lot of people now like cocktail is the new mocktail now. I think, right? Everyone, anytime people get a preference कि mocktail पीना है कि cocktail पीना है, they will most likely go for cocktail. I'm not saying it is good or bad. I'm not getting into that ethical aspect or health aspect right now. If you see scientifically, even 1 milliliter of alcohol is bad for you, right? But an addiction is basis what kind of feelings you're getting when you're doing this, and how much control that you have over the substance that you're taking, be it alcohol, be it marijuana, be it anything else, right? Anything, guys, that we should discuss here, or should we go into? I think impact has been discussed on relationships, but what kind of treatments exist in the first place now around addiction, right? What if someone has become addicted now? What can they do, right? Should we cover this, or anything in particular that you feel has not been discussed around what are the signs and symptoms of addiction? Cool. Let's get into the different types of treatment then that are available around addiction, right? Let's see, if someone has gotten addicted, what can they do to actually overcome that, right? So there are several effective treatments. Okay, so the first one that's mentioned is detox. Okay, so detox is often the first step in treating substance addictions. So it is basically, it involves the supervised withdrawal from the addictive substance to safely manage the physical and psychological symptoms of withdrawal. So medical professionals can provide support and medication to alleviate discomfort and reduce the risk of complications. So I think the first thing that people or doctors suggest, that how do you stop doing it, but you are doing it under a supervised person, which is maybe a medical doctor or a nurse, and basis that you are actually seeing कि हर हफ्ते में मुझे कैसे कैसे करके कम करना है, ताकि मैं ओवर अ पीरियड ऑफ 1 to 2 months में भी पूरा छोड़ पाऊं, राइट? बट द फर्स्ट थिंग इज इट शुड कम इनसाइड यू कि यार मुझे करना है, एंड देन यू विल गो इनटू द डिटॉक्सिफिकेशन फेज over a sustained period of time. Second is inpatient rehabilitation. So there are residential treatment programs wherein people are being told to live at a treatment facility for maybe a 28 to 90 day kind of a period, right? All these programs are also highly structured. There's a supportive environment because you will actually receive a lot of therapy sessions, counseling sessions, and a lot of support. And then you'll also see कि यार बाकी लोगों से मैं जिनसे बात कर रहा हूँ, वो लोग भी मेरे जैसे ही लोग हैं, उन्होंने भी सेम प्रॉब्लम्स फेस करी है, राइट? बट समहाउ दे आर एबल टू ओवरकम इट, राइट? सो देन यू विल ऑल्सो अंडरस्टैंड कि यार ये एडिक्शन छोड़ना कैसे है मुझे, और बाकी लोगों को देख के यू विल गेट मोटिवेटेड टू डू दैट, which is difficult if you're going on that or embarking on that journey completely alone, कि पूरा अकेले में कर रहे हो तो बहुत मुश्किल है वो. बट अगर किसी के साथ मिलके तुम रिहैबिलिटेशन करने की कोशिश कर रहे हो through a treatment program, then it might be much more simpler for you. This is inpatient rehabilitation. The third is outpatient treatment, right? Wherein essentially individuals receive this treatment while continuing to live at home and maintain their daily schedules. Because many times people might not have the time or energy to spend maybe 2 to 3 months as a big boss type का घर लगेगा, 2-3 महीने वहीं पे है, तो people might want to be like an outpatient treatment कि मैं बीच बीच में आते रहूंगा और अपनी डेली रूटीन को भी कंटिन्यू करूंगा और ट्रीटमेंट भी कंटिन्यू करूंगा, because people might want flexibility, they want individual counseling, etc. But this might only work if your symptoms are less severe, right? If they are very severe, then it might be very difficult to actually do outpatient treatment. Then there is something called as medication assisted treatment, which is called MAT, which is approach used for opioid and alcohol addiction. That basically combines medication with counseling and therapy. Okay, there will be medications like methadone, buprenorphine, and naltrexone. Okay, so these medications I think are helping reduce the cravings and withdrawal symptoms. So basically, there is a combination of counseling, therapy, as well as medication, which is culminating and called into medication assisted treatment or MAT. And this is specifically used for opioid and alcohol addiction. Uh, like guys, anything in particular that you want to discuss further, or should I continue this? Any particular like questions or like things that you feel have been incorrectly mentioned? We can reference some other articles. Rehabs in India are costly, whereas government facilities are overcrowded. This is true. This is true. Let's see, let's go through these. But I think this is a valid thing. Like, if someone is actually wanting to go through a rehab, let's see. If someone wants to go through a rehab in, let's say, India, but they don't have sufficient, but they are poor. They are poor. Are there good options available? Let's see what ChatGPT has to say here. Okay, so there are both government and non-government organizations. Okay, government facilities operates various de-addiction centers and hospitals. Okay, these are low cost. There are NGOs. So I think there are some NGOs which are low cost and support them who are need. So let's say for alcohol, I think there are organizations like Alcoholics Anonymous as well as Narcotics Anonymous, which have a presence in India and offer free support meetings. I think this could also be a good way to actually have an intersection of not depending on the government facility, but at the same time तुम्हें काफी सस्ते में एनजीओज मिल रहे हैं. एंड आई थिंक इन सब का नाम भी काफी है, मतलब अल्कोहल एनोनिमस एंड नार्कोटिक्स एनोनिमस, आई हैव हर्ड अ लॉट अबाउट देम, right? So they are good in this space. So there might be these NGOs who are able to tackle this problem at a low cost manner. Then there are some government health insurance schemes that are mentioned here, and there are charitable or non-profit rehab centers, faith-based organizations. I think this is a valid point, right? Sometimes religious organizations also like offer these programs, right? Be it around Christian religious authorities or Hindu religious authorities. Many a times the first thing that people do is either talk to an astrologer or go to a temple, right? Many a times people go to that temple, right? कि टेम्पल में या चर्च में फादर से पूछेंगे कि यार मैं क्या करूं, मैं आई एम नॉट फीलिंग गुड एंड एवरीथिंग, राइट? आई एम एडिक्टेड टू दिस सब्सटेंस, राइट? सो देयर वुड बी फेथ बेस्ड ऑर्गेनाइजेशंस एज वेल. And then there are some scholarships and grants who can't afford full cost of treatment. And finally, there is the community based support, which is AI and on, let's say, that offers. So I think there are some other options that people who are poor can consider, like these NGOs or faith based organizations, because as you rightly said, like Bhavesh, kyunki rehabs can be costly, private rehabs while government facilities can be overcrowded. So maybe NGOs or faith based organizations can actually pitch in to see this problem in a much more structured way. Cool. So we're covering the treatments available. In terms of like the fifth one is counseling and therapy. So there could be individual therapy or group therapy. There's something called as cognitive behavioral therapy, which actually helps individuals identify and change negative thought patterns and behaviors associated with addiction. Okay, so there is something called as cognitive behavioral therapy, which we can actually get into in detail also. Explain briefly. Okay, so let's see what. Okay, so what happens in CBT is that firstly they identify the negative thought patterns, and then they challenge and reframe those thoughts. People have to challenge and reframe those negative thought patterns, and so basically. Okay, so whether these are actual problem statements or you have made it big in your mind, and then you have to replace them with more realistic and balanced ones. These thoughts, and finally you have to develop coping strategies. to manage these emotions and behavioral changes in a healthier way. And it might also involve some kind of exercises and homework that these therapists will give you to test new thought patterns and behaviors, promoting positive change. So I think at a high level, first you have to identify your negative thought patterns, then you have to challenge and reframe those thoughts, finally develop those coping strategies. And this might be more in an iterative and experimentative way, wherein the therapist challenges these beliefs in multiple ways. Okay, so then there is the motivational enhancement therapy, which is a goal oriented form of therapy that focus on increasing the motivation to change addictive behaviors. So let's see this also in a briefly. Let's see what enhancement therapy means. So, okay, it's a collaborative and client centered therapy in which the therapist works together with the individual rather than imposing solutions. Okay, so first it's collaborative. Second is exploration and ambivalence. What does that mean? The therapist acknowledges that the individuals often have mixed feelings or ambivalence about change. They help these individuals explore their feelings and identify the reasons for maintaining the status quo and wanting to change. Why are people not wanting to change? Status quo kya hai? And basis that will be personalized feedback, basis these assessments around the individual, and which will help them see the impact of their behavior on their well-being, right? कि तुम्हारे थॉट्स की वजह से, तुम्हारे बिहेवियर की वजह से तुम कैसे सफर कर रहे हो, right? How are you suffering? And basis that there'll be motivation strengthening. Basically the therapist will use techniques to strengthen the intrinsic motivation of the person for the change to happen, and also help them recognize the benefits of the change and potential consequences of not changing. And then you have to set achievable and realistic goals for these change, and also an action plan to reach those goals. So I think this is the motivational enhancement therapy, wherein you actually motivate that person, or maybe self motivate them for changing their addictive behaviors. And finally there's family therapy, wherein family members pitch in to address this. There are things like 12 steps programs, wherein Alcoholics Anonymous and Narcotics Anonymous, they have a 12-step approach to help individuals maintain sobriety and provide support through group meetings. So what is this 12-step approach of AA? Let's see that. Okay, so setting guiding principles. So it is a set of guiding principles and a program for recovery of individuals struggling with alcohol addiction. Okay, so what are the 12 steps? First is that they admitted that they were powerless over alcohol. So firstly, there should be admission that their lives have become unmanageable and they are powerless over alcohol. So they should believe that a power greater than their selves could restore them to sanity. Then they should make a decision to turn their will and their lives to the care of God as we understood Him. Okay, so they, I think, involve God, and as we like saw some time ago, that faith-based relievers also exist, right? So there is a concept of God in the case of Alcohol Anonymous, as like this is saying ChatGPT. I'll still maybe reference Google will whether this is the real, because many a times people. Okay, let's see. So let's go through. Okay, correct. So I think these are the same ones. So made a decision to turn our will and our lives to take care of to the care of God as we understood Him. So they make this decision that the God will take care of themselves. And second is made a searching and fearless moral inventory of themselves, admitted to God, to ourselves, and to another human being the exact nature of our wrongs. We're entirely ready to have God remove all these defects of characters, and humbly asked Him to remove their shortcomings. Made a list of the persons we had harmed and became willing to make amends. Then made amends to such people, except when to do so would injure them, or so if making amends would make them like injure or cause them harm, then don't do it, but otherwise do it. And then finally continue to take personal inventory, and when we were wrong, promptly admit it. sought through prayer and meditation to improve our conscious contact with God as we understood Him, and when having a spiritual awakening as a result of these steps. So I think the larger point being that Alcohol Anonymous tells people first to admit that you are powerless over alcohol, and then you have to make amends with people who you have caused harm during that process, and have a strong belief in God that you will be able to overcome this. I think this is what they do there, and it might have been working good for them because I have heard a lot of stories around their programs. Then there are some holistic and alternate therapies like yoga, meditation, acupuncture, etc. There is a dual diagnosis treatment as well, wherein there might be two co-occurring mental health disorders like depression and anxiety, or addiction as well as depression. And there will be recovery support systems like there's smart recovery. Okay, what is smart recovery? Let's move into that. The self-management recovery training is an alternate and science-based program. So first is empowerment. Okay, so personal empowerment is there. So it also uses therapies like CBT and REBT that we discussed. There's self-management, there's motivation, coping with urges. So I think everything is trying to tell people to look internally rather than externally. Only in certain cases there is some medication that people are subscribing, right? And then finally, there's an aftercare and continued support that people want to receive. Anything in particular, guys, like we haven't covered or we should cover in more detail? How to support someone who is struggling with addiction? Is anything around the different types of treatment that are available that people can actually look at to overcome this addiction? If not, then we can actually see how we can support someone who's struggling with this addiction. Any comments around this, guys, or should we move on? Cool. Let's see how we can support someone who is struggling with addiction. So, firstly, we should educate ourselves, right? Ki what is this like? Why are people getting addicted, right? What are the signs and symptoms? What are the available treatment types? All that we learned, right? Second thing is we should express concern and empathy, right? So, we should communicate our concern without judgment, so that the person thinks that you're caring about their well-being and are there to support them. So I think creating that safe and non-judgmental space is really important. Otherwise, open communication won't happen from the person who is already addicted. Then there is avoiding enabling, right? So while supporting them emotionally, we should not enable their addictive behaviors, right? We should, like, enabling might mean giving them money, covering up for their actions, making excuses for their behavior. We should not enable them in any way, and there should be clear cut boundaries set, right? That because it is for their own well-being, right? And we should consistently enforce those boundaries for them. Otherwise it will be very difficult for them to manage it on their own. And we should avoid ultimatums, right? While boundaries are set, we shouldn't say that by tomorrow or day after tomorrow you should leave it, right? We should encourage the professional help of therapists, doctors, etc. Practical assistance, which is like finding treatment centers, attending appointments, providing the transportation, or we can participate in family support, right? And we shouldn't use stigmatizing language, right? Which is, let's say, we tell them भाई भेवड़ा है और इस type की मतलब language इस type की नहीं use करने, right? Positive reinforcement should be there, wherein wherever they have small victories and they don't go into their normal like addictive behavior, every time that happens, even if it's small, we should encourage that. And we should also understand relapse, right? Wherein many times they are de-addicted for some time but they again relapse, right? So we should understand when they are having that trigger and how we can control that. We should practice self-care, so that we are also, because when we are actually engaging someone who is facing addiction, we will also get damaged in terms of we'll not be able to, like, our thoughts will also get damaged, right? We should maintain the respect and stay patient. Anything else, guys, we should sort of discuss here? Cool. I think Any resources? I think finally we can just cover this part. So what can people see? Like these are the resources, I think. The first is something called as SAMSAHA, which is the Substance Abuse and Mental Health Services Administration, which is a US based organization. I think let's change it to India because most of our Janata will be coming from India. But even in case of US, there is SAMSAHA, there is the National Institute of Drug Abuse, there's Alcohol Anonymous, Narcotics Anonymous, there's a Smart Recovery Program, there is AI Anonymous and NAR Anonymous. There is the NCADD, National Council on Alcoholism and Drug Dependence. There's a Partnership for Drug Free Kids, and finally, the Faces and Voices of Recovery. In India, there is Narcotics Anonymous, Alcoholic Anonymous. There is something called as Muktangan, which is a well-known addiction and rehabilitation center in Pune. There is CADSE, which is the Community Against Drunken Driving and Substance Abuse. This is a New Delhi-based organization. There's the DAIRC, which is the Drug Abuse Information Rehabilitation and Research Center. It is based in Mumbai. There's Roshni, which is in Delhi. There is Shakti Sugars De-Addiction and Rehabilitation Center in Tamil Nadu. There's Helpage India. And finally, there's Vikalp Rehab Foundation. Any other good sources, like guys, which you know of where people can actually look out for information to see whether um, they have been able to like any good organization that you know of where people can actually go and try to seek help, basically you can mention in the comments. Otherwise, I think we are good. I think we covered a lot of points, but anything in particular that you want to mention here, or as I said, that maybe mention some organizations which can actually give support to these people, you can please mention it in the comments. If not, we can, I think, close the stream. So I think thanks a lot for joining, guys. I will stop sharing my screen and I think we should be good for now. Anything in else that, okay, there is mention of scamsters usually scam people by selling them fake medicines. Okay, selling them fake medicines. Nice. So this is, you're talking about NGO folks or the doctors or who? Like people then would have to actually look at the authenticity of the medicine coming in from a good quality manufacturer. And for, I think these NGOs itself would have to educate people where to buy and everything, because I think a lot of people in our country are still not aware of where to find the right medicine, right? So I think that might help. Cool. I think we are good. We have spent the last 1 hour. It has been a good educative experience for me, and I think I would want to continue this journey with everyone, and let's see how far we can go. And every day, the intent is to learn something new along with the community together. Thanks a lot, guys. Thanks a lot for joining.